So in this lecture, we'll be looking at the phylum Spirochaetota, previously known as the spirochaetes, the class Spirochaetea, order Spirochaetales, and also Leptospirales. So in the order Spirochaetales, we'll be looking at Treponema and Borrelia. In the order Leptospirales, we'll be looking at Leptospira. So other than this phylum, we've already covered selected bacteria in the phylum Pseudomonadota and the cyanobacteria Chloroflexota and Chlorobiota. This shows the main differences among the Treponema, Borrelia, and Leptospira. For Treponema pallidum, it is a helical, motile, and thin bacteria, only in humans and non-culturable. It causes syphilis, and there are 3 stages to this disease. Whereas for Borrelia, most are tick-borne and can be cultured. Borrelia burgdorferi causes the Lyme disease, also in 3 stages, whereas the other Borrelia causes the endemic relapsing fever. For Leptospira interrogans, it causes leptospirosis, also helical, motile, and culturable. Treponema pallidum is the type species and causative agent for syphilis. It is a gram-negative, motile, slender, and flexus form. It is not a true helical but has a flat wave form. It is microaerophilic to anaerobic and restricted to humans and extremely sensitive to environmental stress. It causes a sexually transmitted disease that is more serious than gonorrhea and has 3 stages. So the initial infection is through tiny breaks in the epidermal layer. They will multiply at the initial site of entry and cause a primary lesion, a chancre, for about 2 weeks to 2 months. The chancre will heal spontaneously and the organisms will disappear from the site. However, the bacteria is still present and proceeds on to secondary stage of disease, where it spreads to other parts of the body, usually the area around the initial site of entry. What you will observe is hypersensitive reaction to Treponema, where you have generalized skin rash with lesions that are highly infectious. However, the lesions also disappear and the infectiousness ceases. If no treatment is applied, half of the patient will enter tertiary stage, where the bacteria enters the central nervous system and you will get a range of either mild to fatal infections. So lesions of syphilis or chancre, you can see at the initial site of entry, and then the secondary syphilis where you have rashes on the body, and then tertiary syphilis where you can also get the painful lesions on the skin and bones. So portal of entry is around the genitalia. For primary syphilis, hard, non-painful genital chancre. Secondary syphilis, sore throat, headaches, mild fever, malaise, myalgia, and rash. Sometimes latent syphilis, generally asymptomatic that lasts for decades, but in serious cases you have tertiary syphilis where you have dementia, blindness, paralysis, and gamma lesions. Susceptible humans include sexually active individuals and fetuses whose mothers are infected. Treatment is via penicillin. Prevention is via sexual abstinence, mutual monogamy, or use of condoms. Diagnosis is from blood serum using PDRL tests or dark field microscopy of exudates from the chancre, helical-shaped bacteria. The treatment is penicillin and is best treated at primary stage. Other than Treponema, you also have Borrelia, type species Borrelia and Serina, microaerophilic, an animal or human pathogen, and culturable. The two main ones, you have Borrelia recurrentis that causes the relapsing fever in humans and is transmitted via human body larvae. Usually high fever, muscular pain, followed by a recovery period of 7 to 9 days, and if untreated, there will be 2 to 3 more stages. Mortality is up to 40% for those infected if not treated, and treatment is via tetracycline. This shows the spiral bacteria of Borrelia. So other than Borrelia recurrentis, you also have Borrelia burgdorferi, a causative agent for a tick-borne disease called Lyme disease. Also 3 stages and infects both humans and animals. So other Borrelia are of veterinary importance, causing diseases in cattle, sheep, horses, and birds. An uninfected larva of the tick will infect the rodents or birds that are carriers for Borrelia, and the larvae becomes infected with Borrelia. After the ticks have fed, they will drop off and then they continue growing, infecting larger animals, including humans, where they introduce Borrelia to the animals and humans. So humans will form the rashes, then whenever the ticks have fed, they drop off and then continue to mate and lay eggs, and the cycle continues. And the ticks are very small and can be difficult to diagnose. Lastly, we will look at Leptospira. These are aerobic, culturable, gram-negative-like, helical with 2 polar flagella, some free-living, some parasites, and best observed by dark field microscopy. So for Treponema, they are anaerobic, Borrelia microaerophilic, Leptospira aerobic. For Treponema, human only, Borrelia, both humans and animals. For Leptospira, environmental. So you can find Leptospira terragans in diverse environments with high humidity and neutral pH, especially stagnant waters. Type species with Leptospira interrogans, and they are parasitic for both humans and animals. Rodents are natural hosts. So in humans, leptospirosis occurs when the organism localizes itself in kidney and can cause renal failure and death. So this shows the spiral shape of the bacteria. So leptospirosis is now very common in tropics. It's a common zoonotic disease, and occupations at risk include farm workers and persons in contact with water, for example, pond water, river water. Leptospirosis causes the enlargement of spleen, jaundice, and nephritis, and Transmission is either by consuming contaminated water or in contact when you have breaks in skin or with eyes. Human-to-human spread is not known, and the incubation period is 4 to 14 days. First phase of leptospirosis is flu-like, whereas the second phase becomes more serious, pneumonia-like. Complications include renal and liver failure, although 90% will give a mild form of the illness. In elderly and immunocompromised patients, mortality rate can reach up to 40%. First 7 to 10 days, serology testing is carried out on blood samples. 7 to 10 days, isolation from fresh urine. The culture is on Ellinghausen, Maculo, Johnson, Harris media, as supplemented with rabbit serum, and incubated at 30 degrees Celsius for 2 to 7 days. However, this type of culture method is not practical, but more for research purposes. Medical history is important in order to give a better diagnosis. Treatment is via 100 milligrams of doxycycline orally every 12 hours for 1 week. So when you have rats, rodents with Leptospira in the urine, this will cause contaminated water, mud and soil, and continue to have mammalian reservoirs. So humans with risk factor are those that are in contact with contaminated water, mud and soil. Therefore, humans with the following activities are risk factors for leptospirosis.